dissemination, where other parts of the body can be involved, like eyes, brain, or spinal cord; and secondary bacterial infection, which can increase the risk of impetigo or cellulitis. Important condition is human papilloma virus. So it is an infection commonly cause sexually transmitted infection that can cause a range of health problems, including genital warts and cervical cancer. So, low risk HPVs type 6 and 11 are considered low risk and are associated with genital warts. Type 16 and 18 are considered high risk and are associated with cervical cancer. So, transmission usually it is transmitted through skin to skin contact during vaginal, anal, or oral sex. There is vertical transmission from mother to child during childbirth. Symptoms usually include genital warts, which are small flesh-colored bumps on the genitals. Cervical cancer can cause, which can be asymptomatic in the early stages, and other cancers. HPV can also cause other cancers, including anal, vaginal, vulvar, and oropharyngeal cancers. PAP test can detect abnormal cell changes in the cervix. HPV test can detect the presence of high-risk HPV types, and biopsy can confirm the presence of cancerous or precancerous cells. So, other than this, we will discuss the treatment and prevention part further. So, coming on the symptoms, so genital warts, small, flat, or raised growths on the genital, anus, or surrounding areas, and cervical cancer, so abnormal vaginal bleeding, pelvic pain, or pain during sex. Other cancer symptoms may depend on the type of cancer, example, anal, oropharyngeal, penile, vulvar, or vaginal cancer. So, common symptoms, as I mentioned, was genital warts, small flesh-colored or grayish growth on the genitals can be seen, anus or surrounding areas. Abnormal pap test results can be detected by a pap test. Cervical dysplasia can cause precancerous cell changes in the cervix, which can be detected by a pap test. Cervical cancers can be asymptomatic in early stages. Less common symptoms include anal warts, small flesh-colored or grayish growth of the anus, vaginal warts, small flesh-colored grayish growth on the vagina or surrounding areas, vulvar warts, small flesh-colored on or grayish growth on the vulva, penile warts on the penile region, and oropharyngeal cancer, which can cause symptoms such as difficulty swallowing, hoarseness, or a lump in the throat. There are certain rare symptoms also, like respiratory papillomatosis, which can cause non-cancerous growth on the vocal cords or other parts of the respiratory tract, or there may be skin lesions such as flat warts or plantar warts. There may be asymptomatic infection, so many people with HPV infection do not experience any symptoms, but HPV can still be transmitted to others even if there are no symptoms. So, coming on the diagnosis of HPV, so it commonly involves physical examination, which is visual inspection of the genital area for any visible warts or lesions. Pelvic examination or examination can be performed to check for any abnormal cell changes or lesions on the cervix. And as far as laboratory testing is concerned, so PAP test, also known as PAP smear, is a screening test that collects cells from the cervix to check abnormal cell changes. HPV DNA tests, which can detect the presence of high risk HPV types such as HPV 16 and 18. HPV RNA testing, which can detect the presence of HPV RNA in cells, which can indicate active infection. And biopsy may be performed to collect tissue samples from the cervix or other areas for further examination. Diagnostic criteria usually, if the abnormal pep test results are there, such as low grade or high grade squamous intraepithelial lesions. So, that is one of the things which should be noted. And positive HPV DNA test can confirm the presence of high risk HPV tests. Visible warts or lesions on the genital area can confirm HPV infection. Screening guidelines usually pap tests, so women who are aged 21 to 29 should have a pap test every 3 years. Women aged 30 to 65 should have a pap test and HPV DNA test every 5 years. And as far as HPV DNA test is concerned, women aged 30 to 65 should have an HPV DNA test every 5 years in combination with a pap test. So the algorithm usually moves this way. So you have to perform a pap test to check for abnormal cell changes. You have to perform an HPV DNA test to detect the presence of HPV high risk HPV types. A biopsy could be performed to collect tissue samples for further examination, and colposcopy is one of the investigations where you can visually examine the cervix for any abnormal cell changes. So, prevention of HPV. So, vaccinations is the first step where HPV vaccination is available for both males and females and can protect against certain types of HPV that causes cervical cancer and genital warts. Gardasil is a vaccine that protects against HPV types 6, 11, 16, and 18. Gardasil 9 is a vaccine that can protect against HPV types 6, 11, 16, 18, 31, 33, 45, 52, and 58. And as far as safe sex practices is concerned, using condoms consistently and correctly can reduce the risk of HPV transmission. Dental dams during oral sex can reduce the risk. Safe sex practices where avoiding sex with multiple partners can reduce the risk of HPV transmission. Also, healthy habits, healthy diet, which includes foods rich in fruits, vegetables, and whole grains, can help boost the immune system. Regular exercise, engaging in regular exercise can help boost the immune system. Stress management, managing stress through relaxation techniques such as meditation or deep breathing can help boost the immune system. Screening and testing. So regular pap test, women should have a regular pap test to detect abnormal cell changes in the cervix. HPV DNA testing, women should have HPV DNA testing to detect the presence of high-risk HPV types. Education and awareness. So education towards the symptoms and its transmission is important, and raising awareness is important. And mutual monogamy, being in a mutual monogamous relationship, can reduce the risk. And HPV DNA testing, regular HPV DNA testing can help in the detection of the presence of HPV in cervical cells. So this is just a brief overview of all the sexually transmitted infections, basic tips we have to learn, we have to educate, we need to sensitize ourselves regarding the signs and symptoms, choosing the sex partners carefully, getting checked for sexually transmitted infections regularly, and abstinence or not having sex, also avoiding alcohol or drugs before having sex, using a latex condom whenever you have any kind of sex. So these are the basic prevention steps for basically maximum sexually transmitted infections. So it should always be kept in mind. Next important section is clinical pharmacology and dermatology. So we will deal here with the study of drugs that are used to treat various skin conditions and also what are the topical medications like the corticosteroids. Basically, they are used